Hi, this is Dr. Brandy Gustavus, and this is a PowerPoint presentation on what to expect during the application and testing process of the RHIT exam. If you've gotten this far, that means that you are extremely close to taking the RHIT exam and you are ready to apply to the testing center. First of all, I wanted to take a few minutes to say congratulations to each of you for your hard work and dedication in the program and getting acquainted with the HIT field. The RHIT is a challenging exam, and so is the program. So I give you each a round of applause for sticking with it, for creating great study schedules, and to really put your best foot forward as you prepared and you took these courses. So professionals holding the RHIT credential are health information technicians who ensure the quality of medical records by verifying their completeness, accuracy, and proper entry into computer systems. RHIT professionals use computer applications to assemble and analyze patient data for improving patient care and controlling costs, often specialize in coding and diagnosing procedures, and they can have a solid potential for advancement within the HIM and healthcare field combined with a bachelor's degree. So now that you're about to take your RHIT, where to look for a position. So first of all, most RHITs traditionally worked in hospitals, but you can actually find them in other healthcare settings now. A lot of RHIT professionals that graduated from the program are in office-based physician practices, nursing homes, home health agencies. We have several at Florida Blue doing various positions over there, mental health facilities and public health agencies, in addition to electronic health record vendors, organizations like Parallon. We do have hospital organizations, but they are now branching out to other fields, and they are absorbing some office clinics. So there's definitely a wide range of places that RHIT professionals can work, even in education. So an example of where students are receiving employment after graduation include Parallon, UF Shands, Baptist, Nemours, Ciox Health, Tile Home Health. Many go to where their internship placement was. Some of the positions examples include credentialing, patient access, scheduling, clinical coding, insurance verification. Baptist hired 5 of our students to do various coding positions. Nemours typically hire data analyst positions, and Ciox Health and Tile Home Health offer various types of positions. So RHIT eligibility requirements. In order to take the RHIT, it's not an open certification exam through a HEMA. You have to successfully complete the academic requirements at an associate's degree level of an HIM program accredited by the Commission on Accreditation for Health Informatics and Information Management Education, which you did graduate from. The academic qualifications of each candidate will be verified before the candidate is deemed eligible to take the exam. All first-time applicants must submit an official transcript from their college or university or an early testing form signed by the instructor. And we'll go over the process in just a second. So students in their last term of any accredited program are eligible for early testing, and basically at that time what the student would do is they would request the form from a HEMA, and they would get the instructor to fill it out confirming they were in their last semester of the program. At that time, they can sit for the exam. However, they cannot legally and formally use the RHIT credential even if they pass the exam until they pass the accredited program. So a little bit about the RHIT test questions. How are they written? They're written at different cognitive levels. We have recall, application, and analysis. So some examples of recall is specific facts, procedures, basic concepts, definitions, dates, things like that. It's literal recall information. Application is certain concepts, but you're going to apply them to a scenario. And analysis is more where you're going to be given a graph and kind of analyze how it's going to fit into the healthcare scenario. What information are you abstracting from that? How are you going to calculate full-time employment? Things like that. So if you go to the AHIMA website and look under certifications and click on RHIT, I have the website right up here as well. But if you click on that, you will have an AHIMA application checklist. So you're going to read the candidate guide and we'll go over that briefly. You are going to apply for the exam, and at that time when you apply for it, you're going to pay for the exam through the AHIMA store online. You're going to submit all your paperwork that includes resume, transcripts, and any other documentations you're needing. After you do that, you will receive a receipt of authorization from AHIMA to your email account with a letter. It's called an ATT letter, authorization to test. You're going to read it completely. It's going to have a very special code on there pertinent to you and your information. You're then going to schedule the exam with Pearson VUE, and you're going to do that online. And you're going to verify what materials are needing at the testing center. For the RHIT exam, you do not need any outside resources, and they will not let you bring any in. For any coding exams, you're allowed the coding book, and there's specific ones that they're going to accept. And then you're going to verify your time and date of the exam. If you're late, they do not have to let you take the exam. And we're going to go over all these different things on the checklist in just a moment. For students who graduate, we highly suggest to extend your student membership. They allow you to do that one time at a discounted rate. One, obviously it's cheaper, but two, you're going to get some of the benefits, whether it's books or if you look on here, I have screenshotted for the RHIT exam. If you're a member, it's $229. Non-members are $299. And you also get the wonderful benefits and career fairs and virtual career fairs, things like that. In order to sign up for the RHIT, you're going to go to ahima.org. At the top there, if you see the banner where it says Certification, Training, and Education, HIM Topics, you're going to click on Certification and scroll down to RHIT. When you scroll down to RHIT and click on it, you're going to get to this screen. This is towards the bottom of the screen, so it's going to look a little bit different at the top. If you look to the right, it's going to say register online. You can also do a paper application, but I have had issues with students in the past trying to do the paper application as far as AHIMA receiving all of the applications and pertinent content that's required. So once you register online, you're going to get the next screen to the right. And then you'll see it's going to have the price, and then it's going to have a directory of the programs, which is not of your concern because you graduated from an accredited program, and you're going to click Start Application. Once you click Start Application, it's actually going to make you log into your AHIMA account. Once you do that, you're going to add the RHIT application into your cart so you could pay for it, and you're going to fill out pertinent information like if you graduated from a program, are you in your last semester, your name, address, things like that. After you sign up and pay for the RHIT, you're going to submit all your necessary paperwork. This can take 4 to 6 weeks, so the quicker this is completed, the faster you're going to get your authorization to test letter. The most important thing that they're going to look for is going to be your transcripts. So make sure you send that. You're going to contact SJR State. You're going to send it directly to AHIMA. This is in the AHIMA Candidate Handbook. However, I also included the official certification transcript address here on this slide. You can send it electronically. I always elect to do so. Typically, it does cost maybe $5 to $8, but because it guarantees confirmation that they're going to receive it usually within the same day or 24 hours, I find that a little bit to be of a safer option. So once AHIMA receives your payment and your application, you're going to have an ATT letter processed. An authorization to test letter is going to be offered after eligibility for the examination is approved by AHIMA. and they are connected with Pearson VUE, which will send you the letter by email or a letter by mail if your email is not valid. So please make sure when you're signing up for the exam that you use a valid email. Again, letters will be mailed to an address if they cannot get the valid email to go through. Candidates with an approved application will receive the ATT letter within 5 business days. The issue with sometimes the approval letter taking a little bit lengthier is when you mail in your transcripts. It takes time for St. John's to process it, and then it takes time for them to receive it. They have a lot of students across the United States trying to get in to take the RHIT exam, so it can take some time on the HEMA part to verify the transcripts. And of course, if they have any questions, they have to contact the program director. Once you receive that letter, it's going to contain an authorization number. You cannot sign up for the exam of the RHIT without an authorization number. And it also has an eligibility period, meaning that you cannot sign up for the test and 2 years later take the exam. So it's going to tell you this is good until this date. Usually it's about 4 months. So you have a good 4-month window. This also kind of encourages students to go ahead and take the exam as well instead of putting it off. It also is going to contain a lot of important information like how to schedule the appointment, and we're going to go through those steps in just a minute. In order to help students better understand what to expect during this process, I've included a lot of screenshots so you know what to expect when you receive your letter. So this is an example of the ATT letter, whether you get it through the email or if you get a hard copy through the mail. So it's going to tell you that the exam appointment does not constitute an exam refund, and it's going to give you some information about if you do need a refund, how to schedule the exam. You do need your HEMA ID ready. After the exam, depending on when you take it, and we'll talk about that in a moment, if it's not in the beta period, you are going to receive the exam results immediately. And for your actual RHIT certification, we have a lot of students that are very excited when they pass the exam and they want that hard copy RHIT certification so they can hang it up on the wall or at work or whatnot. It does take about 4 months to receive after you pass the examination. So it does take a little bit of time. So you got to be a little bit patient as far as that, but it's great that all the students are always excited to receive it. So this is an example of what to expect when you get your letter. So now that you have your letter, what do? You're going to schedule a test at Pearson VUE. You're going to go back to that same website, ahema.org. You're going to click on certifications, and instead of exam registration, you're going to go under the helpful resources link, and you're going to click on locate a Pearson VUE testing center. This is where you're going to apply to take the actual physical test. Most of the students take it in Jacksonville in the Southside location. Several students also take it in the Daytona area. Okay, once students click on the Pearson VUE locate a site link, you're going to get to this screen. It's going to say HEMA certification testing at the top. There's different things that are really important on this screen. There's going to be a sign-in button, seat availability, meaning that there are a limited number of seats by day. So if you're trying to get in within 2 weeks, that's going to be a little bit harder. They may have 20 slots that day, so you have to keep checking it, and they're going to change because everyone, in this area is trying to take the exam. You can also take the RHIT practice exam. So once you go ahead and sign in, you're going to check your seat availability, and I'll show you what that looks like in just a moment. So once you click on it, it's going to ask you which type of a HEMA test, because there's a variety of them that you're qualified to register for. So you're going to look on this left-hand side of the screen. You're going to scroll down to the RHIT, which is the very bottom of the screen. On the right, it's going to say find available time. So once you click that, then it's going to go to the screen that says find available time exam details. And this is where you're going to find out what location, what time, and what days are available. So when you click on the exam type and that you want to locate it, at the top is going to be the first screen you come through. It's going to say find available times testing center search. You're going to search by the zip code that you want. I chose St. Augustine. I live in St. Augustine. Once you do that, it's going to have you select 3 of the closest places, up to 3. Most students do go to the Bay Pine Road on South Side in Jacksonville, or Daytona State College. But you're going to just basically kick it and push next. There's some Google Maps for students to review if you don't know where that is. It's a very easy location to get to. And then you're going to push next, and then it's going to let you know what days and times are available. Once students pick the site they want to go to, it's going to come up to this screen, and this is how you can tell what available days and times. So if you look at it, a lot of the times are grayed out. So the ones that are not grayed out, you could click on, and when you click on it, it's going to tell you what times available, what times you have to be there, and what you can bring to the exam. So once students are prepared to study for the exam, which hopefully you've been doing throughout the last few semesters, you need to make sure that you are using the most recent AHEMA prep material. What happens is some students find a cheaper version of the prep material online, and this may be from 2014, 2015. Well, the domains actually change. Domains can actually change it while you're in the program, after the program, anytime they do a curriculum change. So you have to make sure when you prepare for the exam you're using the most recent AHEMA prep manual, and that you've read the candidate handbook and review what domains are on the RHIT exam, the current domains. Sometimes they don't do away with the content. They just might change the domain title and add the content in different domains and shuffle it a little bit. Some things are completely starting to be irrelevant. For example, things that are strictly paper-based. That's not going to be on the exams anymore compared to 2 years ago where it still was on the exam. So make sure this is the current book, the RHIT Exam Prep Manual. Make sure that this is what you've been studying with. It is a great resource. Anyone that has passed the exam has said that this is the book that they study. Look at the rationale in the back. It's a great refresher. This program encompassed a lot of different types of material, so this book kind of brings it all together. You have to go through each question. You have to look at the rationale. Even if you have gotten the question correct, look at the rationale. Make sure you know why, because the same questions are not going to be on the RHIT exams, but the same type of content will. So you have to really make sure you're confident in why you're getting that question correctly. And it's okay if you don't get it correctly, but make sure you review the rationale and you go back and understand why that is correct and you start studying it. So make sure that you're looking through it. The RHIT exam domains have changed slightly, so we'll go over that in just a few minutes. So when you get to the Pearson VUE Testing Center the day of the exam, you're going to arrive at least 15 minutes early. I usually arrive 30 minutes early when I'm doing an AHEMA test. I also drink a lot of water that morning, and the test, because of the stress, because of the cubicle, the computers, things like that, I usually also take a Tylenol or aspirin or something like that right before the test to help me, because it could be a real big challenge if you start getting a really bad headache in the middle of the exam. It is a 3-hour exam, so I highly recommend it. And any student who has taken the exam, that is the one thing that they tell me, is that they are so glad that they did that, because it really helped them, because they started to get a headache throughout the exam. I usually arrive 30 minutes early to the test. In my experience, they've let me sign in and take my picture, because you do have to take your picture and do a thumbprint for verification. So when I'm early, they do allow that. You have to have two forms of ID. If you look at the candidate handbook, it's going to discuss which forms of IDs they accept. After they confirm who you are, they're going to take the picture of you, as I said, the thumbprint, and then they're going to allow you in the testing room. The testing room is one big room, and it's filled with a bunch of cubicles along the walls. They will give you scratch paper if you need to do any calculations. You are not allowed resources for the RHIT. They do give you the white paper, no books allowed, and they do give you noise canceling headphones if that will make you a little bit more comfortable while you're taking the exam. Typically they are quiet rooms, but some people do use the noise canceling headphones. If you need to get up, all you do is raise your hand. They do have a proctor in a room right next door that could see into the room. All you do is raise your hand and they will come and officially pause the test for you so you could go to the restroom, stretch, something like that. Make sure, as I said, drink enough water, eat, and get enough rest. These exams are very draining. So one thing students do not expect, if you're taking the exam during a non-beta period, you're going to receive the score report immediately after the exam. So when you raise your hand so they can get your scratch paper and you're done and you push submit on the exam, they make sure you want to submit it, you're going to check out so you can receive your belongings and check out. At the time of checkout, they are going to actually give you your test results. This catches a lot of students off guard. A majority of the students pass, but even if it's a positive, it still catches them off guard that they received the results of the exam so quickly. So just be prepared for that. Typically what they do is they're going to say thank you for coming in. They're going to fold a piece of paper, hand it to you, and when you open it, that's going to be your exam, and it will literally, I have an example of it, but it'll say pass or fail, and it's going to break down. The missing minimum passing score is the modified ANGOF procedure. It's the universally accepted psychometric procedure. It uses content experts to estimate the passing probability of each item on the exam. The current scaled, and it's typically the last 5 years, is a 300 out of 400 on the RHIT exam. Now, what's very important is students need to call to find out if the RHIT is currently in the beta period. I do not believe it is. What happens is if the RHIT or any of the AHUMA exams are in beta periods, they are reviewing. That means that they've updated the exam and they're reviewing the results to see if they need to take out any questions, revise any questions, things like that. That may affect the scaled score of the exams. So what happens is, since they don't have that scaled score and confirmation, students don't get the results immediately. A lot of times a beta period lasts for 4 months. So if you take that exam in October, it's not going to be until March until you get those results. That is a long time to be waiting to see if you've even passed the exam, to see if you need to retake it and restudy and prepare again. So I always suggest students to call, make sure it's not in the beta period. And if you go to the RHIT link that we've been going to look under certifications, it should tell you on the top right if it's in the beta period or not. Okay, here's an example of the form you're going to get from the person who is checking you out. It's going to say AHUMA, it's going to have your name, your address, and it's going to have the passing score, your score, and if you pass or fail. Below it, it's going to have the percentage of the questions you got correct, and it's going to break it down for you. Of course, there's only 6 domains, so there'll only be 6 domains on it. And it's going to tell you that you successfully passed and that you hopefully will receive your official certification in 3 to 4 months. If you have any problems getting your certification, you do have to contact AHUMA. You always make sure that they have an updated address for you. So what's on the RHIT exam? It's 150 questions. You have 3.5 hours to take it. Most students do take that long because you're reading the scenarios. Of course, 2 questions typically, or 2 answers typically are not correct, so you can throw those out. The other 2 answers both seem like they're good choices. So a lot of students take the time to go in there and really understand the question and what they're looking for. I tell students that when you get flustered in these exams, most of the students are great students. So if you close your eyes, read the scenarios, and really think if you were in that situation. Sometimes stop thinking textbook so much and think, if I'm really in this situation and someone's coming in to get a medical record for their daughter, what is the proper protocol? Really think about what you would do. There's 6 domains on the RHIT currently. Domain 1 is data, content, structure, and information governance. Domain 2, access, disclosure, privacy, and security. Domain 3, data analytics and use. Domain 4, revenue cycle management. Domain 5, compliance. And Domain 6, leadership. If you see on the right hand side, there's different percentages. What this means is not everyone's going to get the exact same test. There's going to be different questions on all the exams. It comes from a pool of questions. And someone may get 24% of domain 1, but the high percent of domain 4. You just don't know. It is a random selection. So let's go over each of the domains quickly. So domain 1, data, content, structure, and information governance. Apply health information guidance, coding guidelines, CMS facility, regional best practices, federal and state regulations. Apply healthcare standards, define the legal record, maintain the integrity of the legal record, audit content completion of the legal record, maintaining secondary health information, educate clinician on documentation and content, and coordinate document control, and maintaining the NPI. A lot of the courses that this came from is HIM 1000, your quality course, your coding classes, and healthcare law. So domain 2, access, disclosure, privacy, and security. Managing disclosing of PHI using law, regulation, and guidelines. Determining right of access to the legal health record. Educate internal customers on privacy, access, disclosure. Educate external customers on privacy, access, and disclosure. Assessing health record dispositions, conduct privacy audits, and security audits. So this is going to be from either one of your PPE courses or your healthcare law course. Domain 3, data analytics and use. This is a new domain. So please look at your book under Domain 3, analytics and use, and start reviewing that content. This was added to the HIM 1000 book later, and of course with data trends and differences, it's just become more prominent in different material that we're doing as HIM professionals. So this kind of data, abstracting data, analyzing privacy audits, security audits, reporting data, healthcare statistics, analyzing healthcare statistics. So a lot of this information is going to come from your healthcare statistical course. Domain 4, revenue cycle management. They've grouped some of the other quality initiatives into the revenue cycle management domain. This includes coding medical record documentation, querying clinicians, conducting utilization reviews, manage denials, conduct coding audits, provide coding education, monitor the DNFB, analyzing the case mix. A lot of this information is going to be from your quality class, your coding courses, and advanced coding courses, as well as some of your statistics courses. Domain 5, compliance. The type of things under this include refining departmental procedures, performing quality assessments and assessment risk, reporting health information non-compliance, ensuring HIM compliance, maintaining standards for HIM functions, including chart completion, coding accuracy, ROI, turnaround time, department workflow, monitor regulatory change for timely and accurate implementation. This is going to be in your management course, your healthcare organization leadership and management course. Also your HIM 1000, your quality course, and a little bit of your coding course. Domain 6 is leadership. You're going to provide education regarding HIM laws and regulations, HIM review processes, modify policies and procedures, establish standards. And this is going to kind of collaborate in the previous domain we just talked about and provide HIM technical expertise. So a lot of this is going to be in your management course. So the RHIT exam is extremely challenging. A lot of professionals that are RNs that have even taken their JD, their Juris Doctorate degree, they all say that the RHIT exam is challenging. So keep that in mind when you're studying for the exam. When I say to look at those rationale and really understand that, please take a few minutes to do that. I also tell students, if you're looking at the domains and you're taking the exam, the practice exams in the book, and you notice that there's 10 questions specifically on how to code a specific type of cancer case, that means most likely that type of case is going to be on the RHIT exam. If you notice 10 questions on the case mix index, review that section of your exam prep book and your HIM 1000 book or whatever coordinated class that was. If it is a question about quality and you notice that they're asking a lot of questions about CMS and a specific content regarding CMS, that means that's going to be on the test. So really understand that. It doesn't happen often, but sometimes it is challenging. There may be a time where a student misses the pass scale system by 1 to 2 points and they need to retake the exam. So how do you do that? So retaking the exam, we don't get immediate notification. Your classmates aren't going to know. Nobody's going to know except for the candidate when they receive that result. You have to wait a minimum of 91 days before you apply for certain exams, but for the RHIT, you can wait only 45 days, so you could apply to retake it. Most of the students have only had 2 that did not successfully pass in the last 4 years, and we had big groups of students. They only missed the exam by a few points, and they scheduled the exam immediately because they knew so much of the content they didn't want it to wait. The longer you wait to take the RHIT, the harder it's going to be, and the possibility of it changing the domains increases. So you're going to resubmit a new application with the appropriate examination fee. Unfortunately, you do have to take the fee again. The transcripts are kept on file, so you do not need to resubmit that. You're just going to wait for your new authorization to test, and they're going to make sure it's been 45 days. So if you are taking the RHIT, you've passed the RHIT, and you are ready for employment, what's next? So soft people skills, it's really important. Some of the group work, some of the team building things, interaction, whether it was with your instructor or with your peers, they're really important to develop your soft people skills. What are they? Why are they important? And if this was in a live setting, I would kind of go through the class and get examples from everyone. So 85% comes from your ability to get along with people as far as why it is important. 15% of the workplace career success comes from your hard skills. Remember, that's only 15% comes from your knowledge. 85% comes from you getting along with people. So whether you have a challenging instructor, supervisor, peer, colleague, it is really important to develop those soft people skills, take a leadership role, understand how to interact, how to handle challenging situations, how to approach your staff or the staff that you're working for. So these are all very important, and this is something that I have found when my students go into interview is extremely important for the department. So a lot of departments will contact instructors and they will ask certain questions about their soft people skills. So it is really important when you're going through your education and different scenarios when there are challenges that students are able to articulate themselves appropriately, in order for us to see those soft people skills develop so we could pass that on to the department. Most coders stay in their positions for a really long time. So it is really important for departments to find that good fit. It's not just can they come in and they code correctly. They want, can they come in, can they code, can they be a part of the team? Don't forget to go review the candidate guide. Remember, that's number one on the checklist when we first started the PowerPoint. The candidate guide, if you look at the RHIT, this is what the top of that screen looks like. It's on the very top under helpful resources. I typically print the entire thing out. Keep in mind that it goes over every exam, so it's not just pertinent to the RHIT exam, it's a candidate guide for every exam that they have. But there is a lot of good information in there. And of course, if you have any questions, please don't hesitate to ask. And again, a round of applause to each of you for making it to the RHIT exam prep PowerPoint. I wish you the best of luck in your career and your future and preparing for the RHIT and successfully passing. If you have any questions, please let me know. I do recommend, in the past, a lot of students would make a group of 3 or 4 and they would meet once a week before they take the RHIT exam, and they would go over questions they had issues with. We've also had times where we would meet up on campus and do mini lectures on certain domains and contents. So there's different ways you can prepare for the exam. Round of applause for each of you. I know that sometimes it's been challenging. Everyone has put forth dedication. I'm proud of each of you, and please do not hesitate to ask. You will be hearing back from me or someone else from SJR State to get job placement information, RHIT certification pass rates, and to follow up with you just to see if there's anything that we could do to help you, whether you're interested in pursuing another educational degree or you have any questions about employment. All right, thank you. Please let me know if you have any questions.